interest you?
What I was in, because I had lost 32 pounds and I started working out. So first I lost the weight and then I waited a year, started working out, and I still had just like a little pouch on my stomach. And I was like, you know what, I'll try it out and see if it works to kind of get rid of it.
Okay, wonderful. Okay, so you've lost all this weight recently, and you just want to get rid of this extra little stubborn area.
Yes.
What was the other treatment that you were researching or had done?
Cool sculpting. I had never done it. I just was researching it.
Okay, great. All right. So, what is it that you'd like? What outcome is it you're looking for?
To lose some of the little belly fat I still have, and to tone and tighten.
And so do you see? I'm asking her lots of questions around how difficult this problem is, how she had it. Did she mentioned casually she looked at something else? People generally just jump over that, and then they don't get a chance to really hear because what was the reason that you did not do the pool sculpting? Why did you decide not to?
I really don't. I couldn't give you an answer. I don't know. I just
never did it.
Never did it. But I just never followed through with it.
Okay. So
no, actually, no, that's not true. Now thinking about it, I had read some article about the cool sculpting. It was some actress or somebody had school come it done, and something went wrong.
So you heard about one of the rare effects,
Rare
and that
effects,
just
yes.
discouraged
I don't remember
you.
what it was, and it did discourage me. Yes, that's actually, now that I'm thinking about it, that's why I didn't do it.
Okay, so this treatment is very different. Although similar to that type of treatment, we do use temperature to have an effect on the changes in your skin. However, this is different. So I'm really excited that can we take a look at your area so you can kind of show me exactly what it is you're looking at and what you'd like to see change.
Yes.
Okay.
Thank you.
So, nope, just.
No, I don't care. I didn't know if you wanted to.
Yep. All right, and so now show me exactly what it is.
Right here.
Did you have
Under
children?
here.
It's like
3.
you had 3 children.
Three
How old?
C-sections.
3 C-sections. Okay. So this is the area right above the C-section that you want treated.
Right here. Yep. That's it.
How old are these 3 babies?
They
of
are
yours?
20, 22, and 25.
Not such babies, right?
Not at all.
Okay. So what we do, do you mind if I touch the area?
No.
So she has like really great skin elasticity, right? For her, especially for her age. Now she told me you're how old?
59.
Which is hard to believe because look at this texture, right? You have to keep in mind she did do these treatments. She did have good texture before, but we're role playing that. This, but generally speaking, her texture of her skin is pretty good for her age. We're talking about the standard treatments for the body treatments are usually more often than once a week if you're 46 and older.
Oh, okay.
But because your texture is pretty good and you're looking to just really like give a nice little lift and tighten, but reduce that circumference, we would recommend her to do weekly treatments, alternating between shape, tone. So she'd come to us weekly. And so the way I would discuss that with her would say something along the lines of, okay, so you're looking to reduce this area and lift and tighten. And so, for clients, so instead of saying, hey, that's going to be $3,000 and I'll see you weekly and you'll pay 300 times 10 today. Instead, I talk about the results. So most of our clients that are looking to have that outcome come here weekly. And in the course of 10 weeks, they have some significant changes that we are really focused on making sure happen. And your ability to leverage what you do at home, like continue that diet plan that you were telling me about, your nutrition program, you work with a trainer, continue doing that. Make sure you're increasing your water to allow you to increase your lymphatic system. When you come in here, we do the compression therapy during your treatments, but it would be great if you did compression or some sort of lymphatic sweating, breathing, and elimination more regularly, at least once a week when we're doing these treatments on your leisure. Those clients that come weekly, it's an hour investment weekly. We put those appointments on autopilot. I will text you a couple hours before your appointment and a couple of days to make sure that those still work for you.
So like, somebody
Okay. I let her ask me for price. You see, instead of saying, "Do you want to spend this money with me?"
Right.
Yeah.
We just talk about, well, these are the results that we're looking for.
Yeah, so.
Right?
Right.
Right? Because
I mean, honestly.
if you lead with, "Oh, do you want to come with me weekly for
Right.
300 times 10, that's 3,000."
Right.
You know, instead what I say
You're
is,
just telling
I
what's
tell
going
them
on,
what
you do.
It would be like emotional shock, like for clients. Sometimes
Right.
they are just hearing like 3,000. That's
Oh, then they'll shut down.
right, and it became objective rather emotional. Exactly.
Yeah.
So instead, I'm talking about the results, what her lifestyle, what her routine is going to be. You're going to come weekly. You're going to make some of these changes. You're going to be excited about the change. So therefore, you're going to want to leverage everything at home. And then I do and if she asks how much, I would say to her, it is 300 times 10, which is less than a single treatment, which is usually $425. So instead of saying it's $3,000 or it's $425, I actually say it's 300 times 10. This is your program that you're going to be a routine regular with us.
Yeah.
We're going to make sure you have an amazing outcome. You're going to love coming because we're going to stimulate your lymphatic system while you're here, and we're going to coach you through the process. Okay? And it's honestly easy then, because they might say, if they want to talk price, I can say you can choose how you pay.
Yeah.
And by choose, I don't mean like I'm going to break it up into many different types of payment plans. I mean, you could pay credit card, debit, Venmo, check, cash, or PayPal. And then that way they're like, usually what's happening in that conversation is, oh, this is my personal credit card. This is my husband's credit card. I have my, mad money in cash. They're thinking logistically how to make it work rather than thinking about how much money it is.
Right.
You
Yeah.
see the difference of when I say the different types of payments we take. Some people will say things like, you can do this in a payment plan. You could pay in like 5 payments. You could do that. I don't say that. I just give them the options of how I accept their money, and they figure out. Because if they're like, all right, if I put this payment on a credit card, I can make different payments.
Correct.
They can choose to pay their credit card however they want to pay their credit card, right? Like some people pay it up front, some people make it. However,
Right.
I think that's really important because people get so caught up in the package and the money because, I looked at what she wants. We made a recommendation. She needs to come weekly for 10 weeks. There was no conversation of like, go give this a try and if it works.
No.
So let's walk through that scenario. Give me
I got fruit I like. Just
will it work? Can I try one?
Okay.
Give me that, spit that back to me.
Well, I'm not sure I want to do this yet, so can I just try one session?
So you can try one session, but I can tell you, having seen many clients do this, that it's actually detrimental to the overall process.
Okay. But
You
what
came-
if I can't come every week?
So you came to me with this problem. Your problem and your concern is the circumference around the size around your area. In order to meet your expectations, it's going to take time to have that improvement.
But can I come once a month?
If you came once a month or just once, what happens in this treatment hour is not lasting. And so I actually am people are disappointed because they come looking for me to help them solve a problem, and now they leave frustrated because they tried one and it's not done, and now they're frustrated. And you there think it's not going to work for me, when in fact it could work for you. We just didn't try it through the correct process. I'm actually doing you a disservice by giving you false sense of hope that one is going to work. And so when people hear it that way, they respect our authority of experience. They trust that I don't just want their money, because I could have told her it's $425 for a single session. What I told her is don't even bother doing a single treatment, because you'll feel good immediately, but it's not lasting, and you're gonna be frustrated in a couple of days or in a week. And now you came to me because you wanted to resolve this concern of frustration, not necessarily slimming. You came to me because you were frustrated with your abs, and I want that to be what we're focused on. So, do you see what I'm saying
Yes.
about the consultation? Because when you're doing consultations for shape and toning of a body part, different than face, like we're taking this totally different. It requires somebody like her, like she said, she works out, she's going to work out more, she's going to probably be more motivated, she's going to drink more water. It requires them to do something to help the outcome.
Yeah, I think.
It also,
What if I say I don't really eat good and I don't work out and I don't drink water? Will this work for me?
so we do have some clients I say that, and what we say is your results will be better and faster if you help the process. We can't overcome the things that you're sabotaging our outcomes with. But if you're willing to consider the outcome you could have, then I can coach you on one or two things. Like, I don't expect every one of my clients to become a clean eater. So what I would say to the client is, like, tell me a little about what the unhealthy habits are that you're struggling with. And it's always good to find maybe one or two specific things that they could nail. Meaning, instead of saying, well, you need to just get better, why don't you call this health coach, spend more money, spend more time, get more frustrated, blah, blah, blah. Instead, find out,
Stop drinking alcohol.
tell me,
drink more water,
what is it that's difficult? And it's our ability to get some piece of a very specific thing. So let's walk through this. When you say you're not interested in becoming, like changing your
Because I really
entire
like
lifestyle.
carbs. I love pasta a lot, and I eat it probably 3 times a week. And I like candy, and I like sugar.
Okay. So I would say that we would probably discourage you to have open access to all of those things. You don't need to go clean, kicking your sugar and carb habit. What I will say is, like, let's focus on maybe one or two things we can reduce. So I'm
that.
giving her like you see what I'm saying?
Yeah.
And so she would say, so which carb or sugar is the most difficult thing?
Pasta and bread.
So, and that's a routine for you for meals?
yes.
3 times a week you're having pasta and bread. So minimally, you should refrain from that 2 weeks prior to our appointment and 2 hours prior to our appointment and 2 hours post. Do you think you can refrain for 2 hours? Again, I gave her the option. If she says no, then I'm going to tell her, no, if you can't give up this addiction for 2 hours pre and 2 hours post, that's a total of 5 hours in one day, then I'm going to say this is not for you. So could you give up pasta for the day that we do your body treatment?
Absolutely.
Right before?
Yes.
Okay, so let's start there.
Okay.
If you can do it for one day, I'm pretty confident we can discuss ways you can reduce that bad habit more often.
Good.
Do you see?
Yeah.
I think, and so if you're just being honest and specific, then they're more accountable. But if we say you're going to need to just cut pasta altogether, it's give them a vote of confidence that they can do something successfully. I asked her just the one day reduce, and then I'm saying I can count on you to try harder. And then when she does this, you know what? When you're after, I can assure you that having done this enough with so many of my clients prior to this, they are generally really excited about the way they feel in the 1 hour. And when we take the photos and we talk about our weekly appointments, that they're very motivated and they are very creative in finding ways to reduce those sabotaging habits. Is that something you think you can do?
Yeah.
I have that same shirt.